The coronavirus knows no borders as it spreads across our planet. But it is not an equal opportunities killer.
It is a disease that thrives on the social determinants and on the weaknesses, the poverty and the poor health status.
So why is it that COVID-19 seems to affect the very poorest among us most of all? So far from being the great leveller, as it's occasionally been described, coronavirus has further exposed inequalities within societies. All too often, it's those at the bottom of the economic ladder who are suffering the most.
Senior consultant Dr. Gian Celik is doing his rounds. Every patient must be tested for coronavirus on admission. For some weeks now, fewer and fewer suspected cases have been coming to the hospital in Darmstadt in western Germany. In the beginning, we saw very mobile people. They were middle-aged to younger patients, students, business travelers, holidaymakers, or those returning from a ski trip, for example. It was indeed an atypical composition for a lung station like ours, and over the course of time it's shifted a bit. The patients are now significantly older again, which is connected to the fact that more and more nursing homes are affected. And what we also have to point out is that we've noticed that some are from a certain social class. Poor working conditions, low wages, little living space, all this increases the risk of infection. And there are also other barriers. Sometimes the most severe cases we've seen here on the ward, where new admissions of COVID patients had X-rays showing almost complete lung failure, these were in patients who could not communicate their symptoms clearly because they did not speak the language. That means the hurdle to seek help was much higher for these people. One corridor further along is the COVID isolation ward. Right now, only one patient is being treated here. When the pandemic was at its peak, though, all the beds were occupied. The doctors here had to pool their experience with the disease to find out which patients were hit particularly hard. This clearly has something to do with social status, starting with the work you do, whether you are more exposed, whether you couldn't work from home, but instead had to continue working at the supermarket checkout or on public transport. Of course, that applies more to low-paid jobs. That was a factor, and in addition, there is also the risk of more severe progression if you have the disease already. Studies have also shown that that is clearly related to a certain social status. Coronavirus patients stay in hospital for a long time. They start to talk, and then they tell Dr. Celik how badly they're doing in their everyday lives. Poverty makes people ill, and that's also the case with COVID-19.
Well, on that point, we can hear from Mauro Guillen, who is a professor of international management at the Wharton School in Philadelphia. He's done research into the effects of poverty on pandemics, so I asked him why coronavirus seems to be hitting the poorest in societies hardest.
Well, there are many reasons. Let's begin with the fact that many of them have to continue working. They don't have the luxury that I have, which is of working from home. They have to continue commuting to their place of work. And also, maybe they don't have a car. They have to use public transportation. So they're always more exposed to the virus itself. And then in some countries, like here in the United States, they have less access to healthcare. And they also tend to live with many other people in their homes. So for all of those reasons, they are both more exposed to the virus, and then they are not as well prepared to cope with some of the likely health consequences.
And is there the further negative impact of that it actually exacerbates the pandemic, having a split within a society?
Absolutely. So whenever you have duality, whenever you have this polarization from a socio-economic point of view, then you see that one half of the population perhaps can shield itself, can protect itself from something like a pandemic, but the other half cannot. But of course, we are all living in the same planet, in the same communities, and we cannot completely isolate ourselves. And given that, the virus knows no boundaries and it travels very quickly from one place to another, we really should be protecting the entire population, not just half of it. So that's why inequality of a social kind, of an economic kind, really hinders our efforts at bringing a pandemic such as this under control.
Is the pandemic widening the gap between rich and poor within societies?
Yes. Let's look at it in the following way. Most of the people who have lost their jobs are people who are towards the lower end of the socioeconomic scale. For many well-paying service sector jobs, these are most of the time highly educated workers. Those jobs can still be performed. Those companies still have customers. They're still having revenue. They can still operate. But it is unfortunately a lot of those workers in other kinds of industries, lower paying jobs that are being, for the most part, affected by unemployment. Think about restaurant workers that have been, losing their jobs. Think about other types of workers, for example, who have to attend to facilities that have been shut down by the crisis. So all of those jobs have disappeared. Most of the unemployed are people towards the lower end of the socioeconomic scale, unfortunately.
So what can we do to counteract the increasing imbalance and making sure that everyone is brought a little closer together?
Yes, so, obviously the long-term game here is to try to flatten the curve, try to achieve herd immunity, try to come up with treatments and also potentially, eventually, with a vaccine. But in the meantime, we need the government, we need companies, we need society to take care of those people so that they're not left behind. Because once again, the negative consequences of this pandemic are so unequally distributed that if we do not do something, we're going to see a huge increase in terms of poverty and just more broadly inequality.
And we've been talking so far about inequality within societies. But what about between societies? Are we likely to see an increase in the gulf between rich countries and poor countries?
Well, I think there are three categories of countries in the world. I mean, we have the least developed parts of the world, the very poor countries. We have emerging markets such as China or India or Turkey and so on. And then we have the richest countries. I mean, from the data that I've seen in terms of forecasts, what we see is that some parts of the advanced countries are going to recover very slowly. That's especially Europe, unfortunately. And also some of the very poor countries are going to be very, very much heavily affected. But among emerging markets, some of them, like Brazil, we know is going to suffer a lot, but others may not as much. So it's a more complicated picture than just the distinction between rich and poor. Obviously, the rich have better healthcare, they have better instruments at their disposal, but that doesn't mean their economies are going to recover as fast from this crisis. And once again, I am particularly concerned about what may happen in Europe.
That's Professor Mauro Guillen from the Wharton School at the University of Pennsylvania there. And now it's your chance to ask the questions. Here's our science correspondent, Derek Williams.
What kinds of antibody tests are being used?
Antibody tests are used to detect whether you've been exposed to the virus and are producing antibodies that could protect you from future infection. There are a number of approaches for detecting them, but two are especially important on the commercial market. The first type is what's called a rapid diagnostic test, or an RDT. It's a point-of-care test that often looks similar to a pregnancy test, and it gives the same kinds of colored line results, positive or negative. The second type of test, called an ELISA test, that's short for enzyme-linked immunosorbent assay. It's performed by professionals in the lab on larger blood or plasma samples. It traps target antibodies on plates that are coated with proteins from a pathogen, and it makes those antibodies visible. ELISA tests are more sophisticated and accurate, but RDT tests are much faster and cheaper.
If my partner gets COVID-19 after me, can I give her a plasma transfusion? Would that help her?
What's known as convalescent plasma therapy has been around for about a century. It involves taking blood plasma from people who have recovered from a disease and injecting it into someone who is still sick. Because the plasma contains antibodies, it can at least theoretically help the recipient fight off the illness. Now, we know the method can bring positive results with other pathogens, and we're hopeful it'll do the same with SARS-CoV-2. But trials are still ongoing on when and whether and how effective convalescent plasma therapy is against COVID-19. Meanwhile, with a lack of other effective medicines, plasma is being administered in emergency situations because it's been shown to be safe, and healthcare authorities are requesting that people who have recovered donate as often as possible.